Everyone aspires to have smooth, bright and younger looking skin. HydraFacial treatment can help pursue and maintain natural, healthy, youthful and glowing skin for a long term. It is in great demand nowadays, especially before special big events, as it provides an instant wow factor in terms of firming and brightening the skin. HydraFacial helps resurface the skin using high-pressure water and gentle extraction methods. Its last step is infusion of the skin with hydrating, nourishing and skin-protecting serums. HydraFacial treatment involves the use of a special device. The device has an exfoliating tip attached to vacuum suction. This generates a fluid vortex over the skin to gently dislodge and remove dead skin cells and other impurities from the skin. Simultaneously, as the device clears the skin pores, the topical moisturizers are delivered into the skin to hydrate it. The treatment ends with an infusion of booster or skin into the skin. These are chosen based on the skin concerns that need to be addressed. Typically, HydraFacial includes 3 steps. The first step is cleansing and exfoliation. Using the vortex cleansing and HydraPeel tip of a HydraFacial device, the practitioner first cleanses and exfoliates the skin. The next step is peeling and extraction. The practitioner uses the tip of the HydraFacial device to apply a chemical peeling solution, usually a mixture of glycolic or salicylic acid, to gently exfoliate the skin. A vortex vacuum suction in this is used to suck out the impurities from the pores and remove comedons. The third step is infusion and protection. This is the last step where antioxidant hydrating serums are applied and are used to soothe and detoxify the skin. To maintain the desired results, it is important to eat healthy, drink plenty of water and have a good lifestyle. Practice a dermatologist-recommended skincare regime and use only a dermatologist-prescribed skincare products. Multiple sessions are required for best results. One should protect their skin from sun exposure after getting the treatment done, and other exfoliating treatment should be avoided for at least a week. To maintain the desired results,